Hi, everyone. Thank you so much for inviting me today. When I read all the materials, I thought, gee, what is left? We have the books out there with the other workshops. You've thought of everything. You've done everything. We've seen everything on the screen. But I would like to just make a few comments. And one of those is starting with awareness. So July is the National Minority Mental Health Awareness Month. And that hasn't been brought up. There's been not as much discussion about minority, diversity, but if you think about the people who have stigma, you think about people with mental health, think about people who are diverse, who are underrepresented in other areas, they have even more stigma. So I think that's one thing I really believe what Sarita said about trust is extremely important. There are studies about trust. Thelma Hurd has done papers on trust, and I think that she has shown that there are differences between those with high and low trust and the outcomes that they experience. Just a few other little things. First of all, at the University of Florida, everyone has to go through hospitality training. And I think that would be something that might be very important for physicians and for staff when they're talking with people. They learn how to listen. They learn how to extend their hand, and they learn the different mechanisms about listening and training. You can also see the ratings go up in the hospital after the training was done. There's also the Ellen Alda communications program that some people use and utilize in their institutions. It's another way to learn how to speak and how to listen, what are some of the principles of listening. There are just a couple more things I wanted to say. One of them is in terms of the social determinants of health. The EPIC records, we talked about the electronic health record, and the electronic health record has something called the junk drawer. And that's where all these things are that would possibly be important for knowing what you want to, how you want to engage with your patient. And I think that's where the social determinants of health land. And many people who are bioinformaticians around the country now, they're trying to find ways that they can insert some social determinants of health into the record so that physicians and maybe the physician's assistant, the nurse practitioner can see those. Two more things I think would be important is I know that we've come a long way and we have patient-centeredness, but I think we need to think about person-centeredness without the patient part of it. And then finally, we all do this. We talk about what's normal, and I think that that is also a word that perhaps we're going to have to lose at some point. Normal. What is normal? And what if you're not?